I'd like to welcome everybody tonight. We have an exciting and special guest in my mind. It seems like everybody on here tonight knows each other through an interesting story. But as you know, the name of my parent company is Zuckerman Future Technology. We bring the future to the present. It's all about making the patient better, thinking in terms of the better. And when I first learned, it feels like it's about eight years with the TayCo Brace. And when I first saw that, I'm like, wow, wow. Um, we have the inventor on. We have Gavin, who's manages. Am I correct, Gavin? You're the CEO. We have Paul Kesselman, who I'm honored that he came on at the last minute because coding is very important in compliance. He's going to talk about that, but I want to talk about Fred Ferlic very, very briefly. If we've all seen the movie Rudy, we know about Notre Dame. I hope you knew about Notre Dame before. Um, if One thing about Fred is that, and I said this to somebody else, I keep forget. Now, when you talk to you, you are so down to earth, and your knowledge. Yeah, it just shocks me when we talked about that NFL player that had the avascular talus problem. You're the only one of every foot and ankle that sort to mention. Is it burned out already?
Mm.
I don't know if you remember that
Sure.
conversation. Like I'm like, you know. So I have one word when I first met Fred and talked to him. It's called journeyman, and that to me is it's somebody that has so much experience that they're journeymen. I mean, brains, intelligence, schooling. By the way, Fred went to obviously Notre Dame. I don't know if you know that. And he tells the story. Which is an interesting story. He went to, he was the orthopedic surgeon for at least 30, 40 years at the University of Notre Dame under Lou Holtz. I mean, if anybody knows football, you know who he is. And it's interesting how you said to me, he used to yell at you, get my players back on the field because of sprains, strains. And this is the TayCo Brace. You see the picture. It's so it just impressed me when you have a problem. He invented the brace because I guess he didn't want to be yelled at. I don't know what it was like with Lou Holtz to be
That's
around him.
exactly right.
It was based on, the need. Need, and that's what a journeyman is. It could be in any profession, but somebody that just has this vision and solves problems because he's looking beyond what's present. And I got to tell you something. Every day I did a little survey, which I knew what the results were, and then I don't want to waste everybody's time because I want to get to the meat of this. Everybody I say podiatrist because I train hundreds and hundreds of podiatrists and other fields with the Remy laser. I said, so you dispensed any moon boots today, or what do you know these big boots after trauma? Yeah, I said, what do you think of them? To me, in my practice, I saw more injuries and more slip and falls and more back pain, hip pain than I ever saw in my life because it doesn't make sense. This makes sense, and you're going to understand that. They're going to go through this with you again. I'm not involved with this company at all, except that when you see great companies and great products, you got to get involved because that's what's important. Because again, we go back to the patient counts. So I appreciate everybody coming on. I don't know, Fred, if you want to say a few things, or do you want to have Gavin get right to the show?
Well, it's necessity is the mother of invention, as David said. And that's the brace started because of that. I got tired of Lou and Brian Kelly and all the coaches we have about yelling at us. Why can't you get them back on the field? Why are they sitting down and all? And with the Takeo, we invented it because it's an external ankle brace and it fits over the shoe and it controls the shoe, which controls the ankle and the hindfoot, the subtalar joints. So anyway, we'll start out with this. Why don't you put on slide one, Gav, or if you want to start it, Gavin, or however.
Yeah, absolutely. So, just to give a quick overview of today, I'll go ahead and give you a little history of TayCo plus a little information about some of the products, some of the solutions that we offer. Dr. Ferlic will then talk a little bit more about the clinical applications of TayCo, looking at indications and treatment protocols. And then Dr. Kesselman will cover coding, documentation, reimbursement, and then we'll open it up to questions. But just thank you everyone so much for being here. So, brief history of TayCo. In our very short 8 years, we've dispensed over 100,000 braces. Now we have over 1,000 prescribing physicians across the country. Our roots are in athletics, so we've worked with just about every pro and college football team, as well as teams in all the major sports. And we also work with the armed services. We work with special forces. It's very hard to fit any sort of ankle stabilization device inside of a combat boot. And so we provide stabilization for folks that are out training in the harshest conditions and jumping out of airplanes.
We have an over 80 NCAA teams, so no matter who your team is, whether you're Ohio State, Michigan, Alabama, Notre Dame, whatever, they're using our brace on Saturday because you put it on immediately and they can return to the game within one series of downs.
Yep. We really think it's the first exponential improvement in ankle and hindfoot stabilization in over 40 years, right? The ankle brace was invented in the early 20th century. The walking boot was invented in the middle of the 20th century. We really think this is the first new, unique approach that makes a substantial difference. We're going to focus today on our two key products, which are the Acute XAB and the Athletic X. So we'll dive right into it. With the question, is there a need for a new ankle and hindfoot stabilization solution, right? As Dr. Ferlick said, invention is the mother. What was it again,
Necessity.
Dad? The
Necessity.
mother of necessity. Necessity is the mother of invention. Sorry, I started it incorrectly. Um, but right, from Dr. Ferlick's practice, I'm sure from all your practices, you find that the walking boot just provides a really difficult experience for the patients. As Dr. Zuckerman said, you got pain in the knee, back, and hip. You got low satisfaction. And most importantly, what we feel is it limits people in their ability to do the things that they love. Right. And so if that's an elderly person, that might mean going to church, going to the grocery store, right? If that's somebody on a college campus, that might just mean walking across campus to go to class. But it limits people in terms of what they love to do.
Also,
We
you
think
go to synagogue in it, Gavin.
there you go.
Okay. But don't forget that, okay, go ahead, Gab, please. Don't
I
forget,
love
I've never met a patient that thanked me for putting them in a walking boot. And you haven't either. So that's why it's unique. Go ahead, Gav.
Very good. And so TayCo, right, we think it's a better solution. 96% as stable as a walking boot, but lightweight, doesn't create a limb length discrepancy. And most importantly, again, gets people back to doing those things that they love much sooner with comfort and compliance. Another unique feature about TayCo is it has the ability to progress a patient through care, right? And so starts like a walking boot in a fixed position, and to our knowledge, the only ankle brace that can then be converted and has different range of motion setting. You see that a lot in knee braces. We think we're the only ankle brace that allows you to fix the patient and then progress them to free motion throughout their care so you can avoid any sort of long-term functional impairment. Got some great research. This is a study out of the kinesiology department at Ball State showing TayCo's 96% is stable as a walking boot. Seems almost unbelievable, right? When you look at the size, the bulk of the walking boot compared to how sleek TayCo Brace is. But there's a number of reasons why TayCo controls the ankle and hind foot just as well as a walking boot, and we'll get into those in a little bit.
We've got 11 other research studies that we can all send you to on what Gavin was saying. Go ahead, Gav.
Absolutely. The next product we'd like to highlight is the Athletic X. So this is a ASO or an athletic ankle brace, a lace-up ankle brace upgrade. Again, super lightweight, low profile, very easy to put on. So you think about your senior patients that might struggle with those ASOs. Very durable. Most importantly, though, 240% of the medial lateral stability compared to something that fits inside the shoe. And again, we've got research on this and we'll explain why. So why, right? Why would TayCo be able to control the ankle and hindfoot this well, right? Whether it be the walking boot upgrade or the AthleticX compared to a traditional inside the shoe brace. And the way our engineer describes it, it's same or similar principle to that of an I-beam. And so essentially, TayCo provides a wider base of support, right? Because we don't need to fit inside the shoe, we can provide a wider base of support. Unique thing about the I-beam is if you increase an I-beam's width by, say, 20%, it doesn't give you a 20% increase in stability. It gives you something like an 80% increase in stability, right? And so by getting that extra width, that extra support, we can really provide an exceptional amount of inversion eversion control. The second reason, right, we perform so much better than a traditional brace is because we anchor in the shoe. Right, as our engineer likes to say, it's like mounting to a beam of concrete versus drywall. Right, concrete just provides a much more stable base of support. And again, these are the reasons why TayCo works so well. It's comfortable, easy to put on, and most importantly, it is exceptionally stable.
Gavin, I just want to interrupt for a second. And
Sure.
there's several more biomechanical reasons, and one is torque. If you define torque as moment of inertia or the moment, that's defined as the perpendicular width between the ankle, as you all know, because you've all had biomechanics courses, versus the center of mass coming down. And so we have a wider control of torque because our brace fits outside the shoe. And it's also more stable because what I call the snowshoe theory. The best thing you could do for stability is to put a patient in a snowshoe. Now, you're not going to do that. I understand that. But there's more. You use the entire width and length of the shoe with our brace, whereas an internal brace, you have to subtract almost an inch because it fits inside the shoe. So there's more stability there. Also, it doesn't rock. It controls the shoe. A brace inside the shoe rocks. It's not part of the shoe. And then a patient needs a shoe that's a half size bigger or a whole size bigger with an internal brace. And lastly, inside the brace shoes are uncomfortable. Okay, a TayCo is not uncomfortable because it fits outside the shoe. Go ahead, Gav.
That's great. We also do have a custom AFO if you might be interested in that. This is completely custom fabricated. As with all of our products, it can be worn with a custom orthotic. So you get the best of all worlds, right? You're not having to sacrifice stability with an internal AFO. You're not having to sacrifice the best orthotic in the world by having that orthotic that's made into an AFO. You get the best orthotic plus the best stability of an AFO. Next up, I'd like to turn over to Dr. Ferlic. He's going to talk about why TayCo Brace exists, right? Why we're passionate about doing this. And I'll turn it over to you.
Because patient satisfaction, that's the end game, as David said before. It's all about patient respect and love, to be truthful. And that's the whole key. And patient satisfaction, like I said before, nobody's thanked me for a walking boot, but you can't believe the endorsement we get from patients. Go to the next slide, Gavin. And so the indications for this are common ankle sprains, fractures. Okay, you can use it as soon as the swelling goes down after a grade 2, grade 3 sprain or a fracture, whether it's displaced, non-displaced, whether you had to operate on it, whether you didn't have to operate on it, you can put on the TayCo. So you may want to use a posterior splint or a walking boot the first 2-3 weeks, and then you convert them to a TayCo. And like Gavin said, we have both a custom and an over-the-counter and a non-custom brace. So it works for sprains, fractures. It works for PTTD, great. Achilles tendonitis, peroneal tendonitis, because it immobilizes that. It doesn't allow for medial lateral sway. Chronic instability, we use it all the time. I've had hundreds of patients with chronic instability. It works post-op, especially for fusions or total ankle. If you do a total ankle on a person over 70, and he's very active, he's going to have a another revision probably. Total ankles don't last as long as total knees, total hips. So if I had a farmer that was 65 years old, I'd have him wear a TayCo for the rest of his life once he's in the field. And it gets you back to work early. You can't go back to work, as a farmer or as a laborer in a walking boot. You can't play golf in a walking boot. You can't do anything in a walking boot. And if you're elder like me, I'm approaching my 80th year, you've got a real problem because I've got some congestive heart failure and things like that, atrial fib, and lugging around that ball and chain, it just doesn't work for my fatigue factor. So I can show you studies where the fatigue is way down as far as the TayCo because it's lightweight, etc. And then lastly, it stabilizes the ankle hindfoot. Don't forget this is an ankle hindfoot brace. So it's the subtalar joint, the talonavicular joint, calcaneocuboid joint, and Dr. Chris Gallin down in Carolina, he's a great podiatrist. He was team doctor for East Carolina for a long time. He uses it for midfoot problems, for proximal Lisfranc's problems. So, but I like to stick with the ankle and hindfoot. So those are the indications. So there's over 250 ICD-10s in the ankle and hindfoot. And our brace basically applies to everyone except for complete foot drop. Next slide, please. This is Pat DeHeers, who's president of the APMA, as you know, and a great friend of mine. And I call him Dr. Equinus because he knows more about equinus than anybody in the world, I think. And not to throw another endorsement, but I think you should use his equinus brace because I think it's magic. And if you can't use that, then do a gastroc recession or whatever. But anyway, Pat, we can send you all types of treatment protocols from both podiatrists and orthopedic surgeons. And he explains here why he uses a TayCo for PTTD, but we'll go next slide, please.
Next, we'll turn it over to Dr. Kesselman for just real brief overview on billing and reimbursement for TayCo Brace.
Sure. So just to kind of reiterate, the most important thing from the compliance perspective that Dr. Ferlic and Gavin have mentioned is that these braces are just easy to put on. We all had patients coming in where the Velcro is all mixed and matched and the cam walker is not put on right, it's loose, or they can't put it on at all. This is just easy peasy. And especially for your geriatric patient who's got a tough time bending over or can't see or can't feel very well with their hands, it just makes the compliance just, shoot through the roof. So unlike a lot of these ankle braces that are out there, the coding and especially, this is not my opinion. I took the high road when I first came on as the coding and compliance person for TayCo and said, we've got to put this through the PTTD validation process. And we did that for all their braces. So what I tell you, what the codes are, which are up on the screen, these you can go to the PTTD website, go to the DMEX system, and you'll find out that just what you're seeing on the screen is absolutely the truth. In fact, I'm looking at the letter that I got in March 2021 for the custom brace. I'm looking at the letter right now on my screen from the PTAC, and it shows the L1970, 2820, and 2755. So what you see here, again, not my opinion, it's fact. And so you could rest assured that the codes being billed for these devices are the codes that Medicare recognizes. And if Medicare recognizes them, chances are your private third-party payers are going to cover them as well. So we have an entire library. I have a full-length 1-hour webinar on the TayCo website from a couple of years ago. Everything that's there is still pretty much the same. Documentation as to why you're putting the patient in a brace as opposed to a cast or a splint or whatever. In very simple to easy read language is all there. The other thing that is a lot of people miss out on is that even the custom fitted braces, you have to do something to them that's beyond what's called minimal self-adjustment. And basically that's more than just strapping. So there's things you may have to do a little bit like grinding or heating, but they're minimal. And if you're used to doing that with orthotics, then, the adjustments on these things are pretty straightforward. Next slide.
And
Paul,
that's,
Paul, if I can interrupt you.
Sure.
Sure.
Yeah, as Paul will tell you, for L1971, you have to, which is the custom fitted brace, you have to bend, mold, or trim. I've
Right.
never had a doctor have to mold. I have to mold the brace. But all you have to do is bend the uprights out to fit the calf.
Yep.
Because people have thin calves, heavy calves. So you just put it over a chair and bend it out or bend it in, depending on whether it's thin. And you just document that. You just say, I bent the uprights to fit the patient's calf. And that fulfills.
You can do it over your countertop, anything, So it's really quite simple to document custom fitting the device.
And don't forget on sprains and fractures, you use the TayCo XAB, which is custom fit, and you need a custom fabricated brace, I believe, which you would either scan or send the mold in for PTTD because they have too much of a deformity to just put in a standard brace, right?
Yeah,
So
and they're also going to be using it for an extended period of time. They're going
right,
to be using it for, possibly lifetime.
6 months or more, correct.
Until you can transition them into another device. The other thing you mentioned earlier, Dr. Ferlic, was that, or Gavin, that you can have the patient continue to use it with their foot orthotics. So this would be an issue where the foot orthotic in the leg that has the TayCo brace, you consider that foot orthotic as an integral part of the AFO, and therefore it would be covered under Medicare. That would be one of the rare circumstances where Medicare may consider the foot orthotic as a separate entity, but the contralateral limb would not be covered.
And one last thing I'd like to mention is about the same and similar. We're all very frustrated with that. But until we solve that, I would have the patient get off Amazon or whatever, go to your local store or whatever, and you can get a walking boot for $35 or $40, as you know. And then I would have them do that, pay for that, and then I would bill the TayCo because you'll get better reimbursement, but a much better result once the swelling goes down. So I think it's going to become the standard of care because it's going to show the patient satisfaction's off the roof, and it's going to show the patient that you care. And as David said before, that's what it's all about.
Fred, can I ask you a question? Because I heard this and I'm absorbing this. Yet, I mean, I've had some severe inversion sprains. If I had this brace, I probably would have continued in the NBA. I'm just joking. But my point is that when you have an acute, I'm talking inversion sprain where it just blows up, you can put this on immediately and in most cases go back to athletic activity. Did you
if they can get in a shoe, if they can get in a football shoe, yes. Now, if it explodes like a grade 3 sprain, then obviously you have to use any kind of you can use any kind of brace, a lace-up brace or whatever, but icing and things like that for a few days until the swelling goes down, and then put them in the TayCo, and they're back to playing for the Irish in 1 to 2 weeks. That's for a severe sprain. And think of any working person. You can get them back to work in the TayCo brace because it's OSHA compliant.
What does how's Medicare, not excuse me, workman's compensation? What's their opinion on this? I would think that they'd be very, very favorable.
They're very excited about it. I work with the company. We're the Elkhart right next door is the RV capital of the world. And they're very excited about it because we can get their workers back to work right away. We can't, you fix an ankle. I had a bimalleolar ankle fracture from a patient the other, 6 weeks ago. They went back to work in 6 weeks. Now, limited duty, don't forget, but after fixation of an ORIF, because you can't go back to work in a walking boot. So I can guarantee you with ODG criteria, occupational disability guidelines, you're going to have to be in the upper quarter percentile to get any patients. And that's the way all of society is going to go. So I can guarantee you can get the patient back to work because it's OSHA compliant. It's footwork. It's the steel-toed shoes that OSHA has to have. It's
I
not
have,
that.
go ahead.
So go ahead, David. So that's why you can get the patients back to functioning so much quicker.
I probably every day I do all personal training when I place the Remy laser because it's amazing for sprains, strains, fractures. It gets the ecchymosis and the edema down within 24 hours. And I mean, to me when I start thinking this, and have you heard of the TayCo Brace? And again, I'm not involved. Fred, how long's it been? It's a coincidence how I met you. It's a nice coincidence, but today in today's world, you just don't, you can't have people, you gotta, to me, the one thing with COVID, and I always was like this, is we're in the NFL, guys. We gotta play first class. You gotta get things that work. Forget about the money. They gotta work. I mean, I'm not saying, just get $1,000, big expensive procedure. This is very reasonably priced and covered, as Paul said, but people expect, that's how you get patients satisfaction. And this is something I wish I was back in practice with this. This is amazing. I mean, come on, how many sprains, strains, fractures, anything, plantar fasciitis, Achilles tendonitis. Can you also address one thing? Because I think I mean, I didn't really understand it to the extent that I've learned tonight. You called it medial and lateral sway. So how well does it control, inversion, eversion, or the subtalar joint? How would could you go a little more into that? Because this is very, to me, I thought it was just, ankle instability, but it's more than that.
Yes, it's with two of our studies show, and these are all biomechanical studies done out of universities, show that, and as far as the walking boot, one study shows we're 96% as effective as the walking boot, but without all the deleterious effects. And another study showed we're 86% as effective. But
Wow.
with the walking boot, you can't play golf. You've suffered from chronic instability. You can't do anything, and you can't wear a walking boot for the rest of your life. And
You go to TayCo.
Yep, that's right. And so you can use a TayCo the rest of your life. So we'll go ahead with the question and answers. But David, I like your approach in that our mission statement is to care for patients, and it's a mutual pact. Can the patient trust you, and do you trust the patient? Okay, you have to be committed to excellence. That's what the patient wants to know. And then lastly, do you care? Lou Holtz has a great statement, and then we'll go to question and answer. If you want to be happy for an hour, eat a steak. If you want to be happy for a day, play a round of golf. If you want to be happy for a week, go on a cruise. If you want to be happy for a month, buy a new car. If you want to be happy for a year, win the lottery. If you want to be happy for the rest of your life, show somebody you care.
Help the other person.
That's right. So we'll go ahead with the Q&A right now.
We have one question, and I believe Dr. Ellsworth studied with you. Her first name is Twee. I don't know. She mentioned something. She knew you. But anyway, her question is this. I may have gotten a little confused because it was a text. I'll have to look at the text she sent me. This is for Dr. Kesselman. Is a DME license required to bill for these braces?
The question really is if the patient is on Medicare,
right?
The answer would be yes.
Right.
Just as it is for any other DME item, you have to enroll in the Medicare DME world. And there's 2 enrollment carriers now. They've changed the system a bit. There's 2 enrollment carriers depending on where your practice is. East of the Mississippi or in the NPE East, the National Provider Enrollment carrier, which is the Novitas people. And if you're west of the Mississippi, you're in NPE West, which is covered by Palmetto, which used to be the National Supplier Clearinghouse. So those same people are still in the NPE West. And so that's basically what you have to do. And it is per office. If you have 5 doctors in one office, you're enrolling the entire office, not just one doctor. If you have 2 office locations, then each office location has to be enrolled separately. There's a fee associated with this. It's not like enrolling in regular Part B Medicare where it doesn't cost you anything. So there is a fee that you have to pay, a triennial registration. Works out to about $800 or so. But if you think about it, if you do one TayCo, you've made your money back.
Yeah,
So
we have another question. But before I go to another question, it's a Dr. Ho that asked that question. She said to me, text me, we're very good friends, colleagues. Um, she said she learned from you and she did a residency at South Bend. She says
Yep.
she's met you and learned from you.
We know each other well, and did a delightful person and a very knowledgeable person. And that I have a Notre Dame Orthopedic Symposium, which I've had for 29 years. Pat DeHeer's spoken at it. Uh, we have some great podiatrists that come and great orthopedic surgeons. We all mingle on Thursday night. We all drink too much and smoke too many cigars, David. And Friday we have the symposium, and this year it's going to be the Southern Cal Notre Dame game, October 18th. So if anybody wants to know about it, please contact me tonight or tomorrow, and I'll get you the invite, and you'll just have a unbelievable experience.
One thing that's important is before we forget it, I don't know if there's a last slide. Will we have a contact? Do they contact you, Gavin, for more information and ordering and to get started? Because I'm getting texts that say, "How do I get started?" Please,
Yeah.
that will be up on the screen before the end.
Yes, I'll put something up on the screen. Yeah, it's TayCoBrace.com. But I'll go ahead and put up a slide with our contact information as well. And yeah, to that point, we'd love to have folks experience the difference, right? And so 2 ways to do that. Number one, probably best way is if you've got a patient that's struggling in a walking boot or an internal brace, let us know. We'll get you a sample that you can use to help that patient. We'd love to do that so you can have that experience with your patient. Or I guess, if you'd like to experience it for yourself, we invite you to wear TayCo for a couple days and then wear a walking boot for a couple days. So you can really, I'm serious. It's the best thing. It's the best way for you to experience, the real power of TayCo, and just, try to get around every day for 3 or 4 days. And,
I'll answer
noting that
that.
most patients are in those things for a long time. So yeah, we'd welcome you to experience the difference of TayCo Brace.
Yeah, I'll answer that without putting the boot on. You can't walk.
Nope, you got to do it. If you're going to do it, you got to do it all the way.
I hope they don't trip. Okay, but anyway, it's from an anonymous attendee. This is for Paul. I do not bill, I don't know if it's for Paul, but it says, I do not bill insurance. How much would the brace cost for the provider?
I guess that's really a question for Gavin.
Yeah. So it doesn't matter if you do bill or you don't bill insurance, right? We have prices for wholesale pricing for medical providers. For medical provider pricing for the AthleticX, list price is $125. We have discounts down to $75. The acute XAB list price is $225. We have discounts down to $125, and the custom AFO is $395.
And as Paul showed you, the reimbursement for a XAB from Medicare averages about 530, and for the custom brace averages about $1,200.
I have a question. What questions should we have? 2 questions. I'm sure there's more. Some people don't. What questions should be asked? How's that? I mean, I always tell my doctors, here's the questions you should be asking me. You think we've covered everything? I think we have, but is there any question that you think they should know about in order to educate themselves so they can obviously help their patients?
Sure. So Dr. Ferlic and I discuss this all the time. And we just discussed this a few hours ago. It's know how to do the examination and know which questions to ask your patient. A long time ago, when I was in school back in the 70s, we had a physical diagnosis professor, and he said to us, I'm going to teach you one thing. I'm going to train you to ask the right questions. And if you ask the right questions and you go down the right path with the questions, the patient's going to probably tell you what their diagnosis is without even knowing it. But you have to know what questions to ask. And that's what I think is the key problem today with managed care and doctors rushing through patients in a X number of minutes is they don't take the time to do a proper examination.
And if
And
you
I think
don't
once
ask,
you do that, you'll get the answers that you'll need. You'll know which brace the patient needs. You'll know whether they need something custom fitted or custom fabricated. If it has to be custom fitted, you're going to know what you need to do.
I think, and to add on to that, I think that I would ask, I'd ask the patient, do you want to be functional? Do you want to go out shopping? Do you want to be able to walk around your kitchen? You know, in a walking boot, you can't do that. And do you want to be protected? With internal ankle braces, you're not protected. We've shown that with the, collegiate and NBA players. So, and the NFL players. So, do you want to be functional? That's the key. You can't get on a golf course with a walking boot, but you can with the TayCo because it fits over your golf shoe. So to reiterate what Gavin said before, you have to have a good structured shoe. If they have PTTD, a straight lash shoe. If they have a cavus foot, you want a curved shoe. But you have to use an orthotic because the orthotics to me are essential. As you get older and older, your foot's going to collapse. Believe me, 80% of them do. So I think the orthotics are just as important as the brace. So please, please, please put the patient in an orthotic also.
Okay, we got more. Let me see. We got a couple. This is a good one. Dr. Ho. I'm used to calling her Ellsworth. That's her married name. So
That's fine.
I've met her husband. He's a great guy. It's like I call her Ellsworth by that's her. I don't call women by their last name, but her I call Ellsworth. But anyway, she says, and you may have answered this already, but I'll read it just to make sure. Any particular type of shoe best? What is the size like based on ankle girth, width, shoe size? How about pediatrics?
Well, we don't have our brace is meant for people probably 16 and over, maturity. We don't make a real small brace, and kids don't mature, as you know, till women at 14, 15 and boys at 16, 17. So it's an adult brace. We've been asked to do a pediatric brace, but we just don't have time at this point.
Or
But um,
here's
the,
I gotta go ahead. There's a great question after this, which is important.
go ahead.
Can you drive
Well,
with
and
me
then
on your
to finish that, it is sized by shoe size. And so the nice thing about that, certainly the custom fabricated brace will need to know ankle width and some different measurements. But for the acute XAB and the Athletic X, it's really all about the shoe size. And so you're going to want to wear, as Dr. Ferlic said, a rigid walking, jogging shoe, work boot, hiking boot, diabetic shoe. All of those work really well. The really nice thing as well about TayCo, relative to a walking boot, is the uprights have the ability to conform to a unique anatomy. So if you have a patient, say, with a skinnier ankle but a really big calf, which I know a lot of patients have that these days, right? TayCo has the ability to conform, whereas with a walking boot, you might be putting a size 6 shoe in an extra large walking boot to fit them in. Well, that ankle is just swimming, right? There's no stability down there. And so TayCo has the ability, right, based on the shoe size, and then can also accommodate, a unique anatomy or a really big calf.
So the sizes of shoes, we have small, medium, large, extra large. So what is it? A 5.5 to a 7 is a small, and the 8 to
Yeah,
10
it can
is a
fit.
medium, and it goes up. We got the chart. We can send you the chart,
Yeah.
obviously.
It fits from a women's size 4.5 up to We actually had a NBA, we typically do custom braces for really large feet, but the extra large was worn by a size 20. He's a 7'4" center in the NBA, and the extra large fit him. So, but yeah, size about 4.5 women's up to about a size realistically 18 men's. So a good size range.
Now, I want to talk about one other thing. It is a comparison. I don't know. Just I want to, I think I know the answer, but just popped into my head. I didn't do well with an Arizona brace. It paid well. I put it on, and they gathered. Maybe I didn't have the biomechanical know-how. So if you're talking about an Arizona brace and a Ritchie brace, I'm talking about the ones you're using. It's like a coffin. You put it. I mean, it's really tight. You can't move it. You can't move an inch.
How many people are comfortable in an Arizona brace? That's the biggest problem. I mean, I know you need them sometimes if you have a grade 4 PTTD with the ankle joint involved, then and your foot is sideways, you're unfortunately going to have to use an Arizona brace. That's the only choice to help the patient.
I didn't
So
do well with them. I could
no,
not.
nobody's comfortable in. People aren't comfortable in internal braces, period. So you
I
just have to,
you remember,
the patient will know that. And the last thing I'd like to say is that I don't mind making patients. I make FaceTime calls to patients all day. I enjoy patients so much that if you put it on a patient and you want me to follow up with that patient, I will FaceTime that patient the next day. I will make sure it was put on correctly, and I will answer all the patient's questions. I
wow.
make FaceTime calls all day because I love it. I
Yeah.
just love patients to respond, and I like to make them better. So you can give them my cell number and tell them to call me after you use it and just say, if you have a problem with the TayCo, let me know, and I will solve it for you.
I think that's amazing. And I think you're being sincere because there's not, I mean, when I get off, I got to talk to one of my distributors. They can't get the password in the laser. They forgot it, even though we write it
I'm
down.
sure. I
But
had a patient today, a nurse's aide called me that she works for a podiatrist. She fits the braces for a podiatrist. And she called me today and said, can the patient call you? He can't quite comprehend how to put the straps on or something like that. Because when you tell a patient, they get mixed up, right? Sometimes. So I said, have the guy call me tomorrow at noon. And if he can't FaceTime me, I'll have his daughter or something like that FaceTime me. So, it's a pleasure to treat patients. So it's a privilege. So,
I once had a son. I was doing an externship in a podiatrist's office. I only went in there because I was dating the receptionist, but that's besides the point. They had a sign up there. I'll never forget this. It's a privilege to treat you as my patient. We're talking a massage. This is in the mid 70s. I can still see it there. And I'm looking at that and I said, wow. In my father's practice, he loved Vince Lombardi, loved them. All the Vince Lombardi, uh, you know, sayings were on the wall. We grew up with Vince Lombardi. He was God in my house. Unfortunately, Notre Dame was not. It
well,
was.
but there's a great book about Vince Lombardi, When Pride Mattered. Okay. And we're professionals. And so we have to act as professionals. And if you act as a professional, the patient will trust you. He'll know you're committed to excellence
You
and
know
he
it.
knows that you care for him. So that's what we are. We're professionals.
Yep.
We're not business people. We're professionals.
I know with me, if you need me and I'm not sleeping, I'm going to pick the phone up.
Well, you can call me even if I'm sleeping, David.
I think, did we have anybody? One thing I don't know if it's my slide. The takeobrace.com is a little bit off. We have Gavin's
Oh,
number, his cell phone number, his email. I
Well,
know it's
give them,
TayCo
give them,
Brace.
give them my cell number and they can call me anytime. My cell number is 574-286 2273 574-286-2273. And if the best way probably is to text me and say, hey, I'm available tomorrow at noon Central Time or Eastern Time, please call me. I will call you at exactly the time you tell me.
I still remember you. I was working with an NFL football player because I do ESWT. I have a mobile company, and they had every expert around. And you had the most common sense talking to them. It was amazing. I
Well,
still, you just went and talked to them, you know, it was like, which was, I appreciated that because you gave them the answer.
well, I just appreciate people that ask questions. I don't have all the answers, but I'm going to try.
So the last comment is from Dr. Ho Ellsworth. Great presentation. Thank you.
Thank you, everybody. I really appreciate it. And David, thank you so much for allowing us to be on this. And Paul, thank you for your knowledge that you've given us as far as compliance and coding.
Excellent.
It's
Excellent.
very appreciative.
Thanks
very much,
we've
everybody.
kept Fred on the straight and narrow.
Okay. You give me the call anytime. Okay.
I'm
Thanks,
going to
guys.
give you a call for a minute, Fred. I just want to tell you something funny.
All right.
Okay.
Thank you, guys.
Bye.
Thanks, everybody.